And we're joined by our reporter Wu Bin, who's in Shanghai for us. So Wu Bin, the authorities there just held a briefing on local control measures. So what can you tell us?
Well, since Monday, we've seen multiple rounds of mass testing conducted in the city, and today officials released the results of the previous rounds, which is very important for experts to analyze and predict the situation afterwards. So Shanghai has conducted 95.2 million tests since Monday and found over 94,000 positive cases. Regional cluster is still one of the major problems, and the city decided to conduct another round of mass testing from today. And after this, the next round of mass testing, the city will be divided into 3 levels. Actually, we've seen other cities in China have done this in their fight against the virus. So to the communities that reported no positive cases in the past 14 days, they will be recognized as prevention areas, and people are allowed to move within their districts. To those that reported no positive cases in the past 7 days, they will be recognized as control areas, and people are allowed to move within their neighborhoods. And to those that reported positive cases in the past 7 days, they will be implemented with the most strict rules. They are not allowed to leave their houses.
Well, so China has been stressing this dynamic zero policy. So put that in context for us in terms of Shanghai, and what do medical experts say?
Well, according to the chief director of one of the temporary hospitals in Shanghai, he said Shanghai is now facing a very serious challenge of aging population. Over 20% of the population in the city are over the age of 60. In some old residential communities, the ratio is even higher. I've been to one of the communities before the closed-off management, and local official told me the senior citizens even take 45% of their population. So senior citizens, often with chronic diseases, and children are vulnerable to the virus and are often developed to common or even severe cases. And I've talked to the deputy director of Jiangsu medical team yesterday, and he also said that one of the very important jobs in temporary hospitals is to understand clearly about every patient's chronic disease history and monitor their health conditions. He also added that now we've found more mild and asymptomatic cases, not only because the Omicron variant is less fatal, but also because we test early and find these cases in a very early stage. And that's why he said quarantine is still very necessary. One, to protect more people from getting infected, and 2, to monitor those infected closely to prevent asymptomatic from developing into mild cases and mild into common or even severe cases. Back to you, Jiayang.
Okay, thank you so much. That's Wu Bin in Shanghai for us.